My name's Edward Chen. I'm the department chair of OBGYN at the Cleveland Clinic. My background and training is obstetrics and gynecology initially, and then subspecialty in maternal fetal medicine, which is high-risk obstetrics. Many women have a birth plan or have ideas of what they would desire or expect for their labor and delivery. There's a lot of misconceptions of what's normal and what isn't normal, what hospital level care is, and what actually goes on. Many of the things we do are related to improving the safety of birth. Some people want to have an epidural for their labor. Some people want a natural childbirth or what we call an unmedicated delivery. I think having reasonable expectations and what things actually go on within any birthing unit can be discussed. Many people will start having symptoms days before they actually go into labor. Most people will contract throughout their pregnancy. Most of the time, it's not going to be appreciated. Often people, as they approach delivery, will start feeling some contractions. They'll start feeling them that are relatively short, maybe 15 seconds to 30 seconds long. They'll be infrequent, maybe once to twice an hour. The contractions can often cause your bag of waters to break. So a constant leak of fluid from your vagina is a sign that your bag of water might be broken and is a sign that you may be going into labor. Pain of childbirth is hard for me to describe because I've never been pregnant, but most people describe it as the most severe pain they've had. Often childbirth, we use regional anesthesia or epidurals that take the edge and sort of remove a significant portion of the pain. But in women going through natural childbirth, I think pain is perceived differently by different people. Often when you're initially in the early stages of labor, you'll have a lot of contractions, so you'll feel cramping, but you won't have significant amount of pain because your cervix really doesn't change that much. With your bag intact, the cervix really is stretched, but the bag of waters acts more as a shock absorber, absorbing some of the contraction pressure. As you go into active labor, your cervical dilation increases much more rapidly, and that's where most people feel significant amounts of pain, and it tends to be the most intense. But after your cervix is completely dilated, you'll start feeling pressure more towards your vagina and your perineum as the pressure of the head comes down to expand the vagina. And that's a different type of pain, similar to the feeling as you have when you need to have a bowel movement. Most people describe the first labor as longer, and statistically, when we look at or measure it, tends to be longer. Many women will start contracting days before, but you're definitely not in active labor. You may be in what we call latent labor. Latent labor is when you have contractions, but you have minimal cervical change. In first pregnancies, because you tend to be focusing on those contractions earlier, or because it's a new experience, that can happen 12 to 18 hours before you actually get into active labor. And people who've had children before, that period of what we call latent labor tends to be shorter. Breastfeeding is a way to suppress ovulation, but it's not perfect. So even breastfeeding women will continue to ovulate. Actually, about 10% of breastfeeding women will begin to ovulate 3 to 4 weeks out from delivery. So you should use some other form of contraception if you don't want to get pregnant again. I would go with the saying that time heals all wounds. So most people will appreciate what they went through less and less, I guess, intensely as time goes along.